I noticed a need for medical care, particularly among those single men. They didn't qualify for any of the other programs that the community had at that time.
And many of them have had no access to health care. And as a result, when they come to our doors, their care, in some cases, has been very fragmented. We're kind of there to kind of piece things together.
Dr. Baxter's got a big heart, and he says, Gordy says, won't you do me a favor? Why don't you show me how to do a little dentistry, because I've got a lot of patients that are in dental pain, and we don't have any dentists. I said, well, I'll do one better. Just let me go down there with you, then we'll take a look at it, and we'll see what we can do.
It was important to initiate vision services for our patients because of the high prevalence of patients with diabetes and hypertension and the eye complications.
The outreach program at HCCH came about when a lady who was on staff here found out that there were people living in camps in the woods and just took it upon herself to go out into the woods and to bring our services to them.
Once the Healthcare Center for the Homeless received federally qualified health center status, that allowed us to start accessing federal grant funds that were specific for community health centers to expand on the volunteer efforts that were provided.
When I started working for Healthcare for the Homeless, there were a couple of real deficits in the clinic as we were running it over at the Coalition. And one was that we didn't really provide any mental health services or substance abuse services, and those were two of the major issues that I felt were missing in the clinic.
It was important that we open our own health center because we had been operating out of donated space from the Orange County Medical Facility and the Coalition for the Homeless. And at the time, the board had the vision of a comprehensive health facility that would be able to meet the growing need of the people experiencing homelessness in our community.
Here we are able to provide a convenient setting for the patients to get medications at a low cost, which improve their overall health and outcomes. So that's very important.
The mobile medical unit was launched because of the lack of medical facilities in the areas where most of the homeless people were usually located. They were unable economically or physically to come to our facility.
Mobile dental units are crucial to our oral health services because we have the possibility to go to the patient.
We determined that there was a need to have satellite sites because we had so many patients accessing care here in Orlando that were coming from great distances.
We believe here at HCCH that housing is health care because what we found over and over again through the research and the studies is that when somebody is stably housed, we find that their health outcomes vastly improve.
We are excited to announce that we recently opened our first pediatric healthcare facility called Orange Blossom Pediatrics because there weren't many pediatric facilities that were easily accessible in the community.
At Orange Blossom Family Health, our aim is to provide access to quality, comprehensive healthcare services that will restore our patients' health, keep them healthy, and help them to lead productive lives.
How many people did we see that first year? Be around 200 different individuals. And today, we're serving over 20,000 people a year.
And we don't ever want to lose sight of the fact that that's our #1 goal, is to take care of the homeless. But as we progressed, we realized that there are a lot of people in Central Florida that are one step, one paycheck from being homeless.
They just go the extra mile.
They just kind of held my hand and led me in the right direction.
When I got here, the staff recognized what I needed.
They walked me through the whole
disability process with Social Security.
My life has changed almost 100%.
If I had a problem, they would solve it quick.
This is a wonderful place that people should come and see the work that these people are doing.
They've been good to me.
I can't say thank you enough for everything that's been done for me here. So, you know who you are. I love you. I have a lot of love for this place.